It's Maternal Health Awareness Day, and the state of Arkansas has one of the highest maternal mortality rates in the country. That's why Arkansas has made strides to improve maternal health care in the state.
5 News reporter Kayla Davis spoke to stakeholders today on what changes have been made over the last year.
In 2024, Arkansas created a task force to address preventable pregnancy-related deaths and found key topics to focus on, including education, healthcare access, and Medicaid. And with education and healthcare access comes more awareness on the need for doulas. Last year, UAMS partnered with Ujima Network to train 80 doulas in the state. Nicole Fletcher with Ujima says they had about 40 to 50 apply to the program.
To now have 140 some odd applicants is a huge thing. With the cost being covered through the partnership with UAMS, I think that opened the door and it removed a barrier where people felt like, oh, this is possible for me.
Fletcher says funding will only allow them to accept 60 into the 2025 program. When I asked her about avenues to find more funding,
we can train all of these individuals statewide, but if we don't have Medicaid reimbursement, the clients that may need this service the most may have that barrier of access.
Luckily, lawmakers in Arkansas are working to provide more Medicaid coverage right now. State Representative Aaron Pilkington says more coverage for postpartum mothers 1 year after birth, reimbursement for remote ultrasound and fetal non-stress tests, coverage for blood pressure monitors, and more can prevent life-threatening complications.
If we can get them in early, if we can address issues early on, if we can deal with that, we ultimately create larger cost savings down the road. Because trust me, a eclamptic post a birth or C-section that could have been prevented are way more costlier than a normal, healthy, easy birth.
Fletcher says she's hopeful some of these changes will be implemented by the end of the 2025 legislative session.
Every single lawmaker, every single politician, every single community, every single individual really wants to see Arkansans thrive. And we just need an opportunity and we just need time to figure out the best way to collectively do that. And that's what we've been doing, and that's where we are.
Covering news where you live, Kayla Davis, 5 News.